Hello, I'm Dr. Richard Fieldhouse, and this is the NASGP podcast, The Art of GP Locuming. And today I'm talking to Dr. Kamilla Porter. Welcome to the podcast, Kamilla.
Thank you. Delighted to be here.
Thank you. And so you and I have known each other for so many years. I remember Dr. Sarah Chambers and myself. Dr. Sarah Chambers is also is sort of the locum deck lead at NASGP, and we came to meet you in Essex when you were part of the LMC there to talk about we very first started to develop the NASGP platform,
hmm
booking platform and things. So we've kept in touch, and we've worked with you a lot over that period of time. So yeah, so welcome to the podcast, and let's really what we're going to do is just talk really about you as your career from when you first qualified as a GP to what you're up to at the moment and what your plans are going forward. So let's start off with when you qualified. I know we've just been talking about that.
Yes. Yes. Yeah. I was just mentioning that. 2 days ago, I was back in the courtyard of my medical school for our 30-year reunion since we graduated, which was a bit scary, but also lovely to catch up. And there was lots of reflective conversations, and it is quite quite a thing to look back at so many decades. And I suppose when you ask about my GP career, the funny thing is, as we were chatting about, what our aspirations were when we were graduating, I remember being very clear that I wasn't sure what I wanted to do, but I was very sure about two things, which was number one, I didn't want to be a surgeon, and number two, I didn't want to be a GP.
Oh, interesting.
Uh, um, and I basically made my own rotation. And I was always drawn to being a generalist. And when I look back at the different things that I did, I definitely think general practice was always going to be my niche. And I ultimately made a very positive decision. And sometimes I think it's quite good. If you have something you're unsure about, I think it makes you really weigh up the pros and cons. So I think it was partly at the time, it was a very traditional medical school curriculum. There was a lot more exposure to hospital medicine, had very minimal GP experience, hadn't found it particularly inspirational. And there was so much kind of negative commentary about GPs. And I think that probably gave me that, um, you know, less than inviting prospect of being a GP when I graduated. Um, but I eventually saw the light.
I suppose with that approach, that's really interesting, isn't it? If you're going into a discipline that I guess you were initially skeptical about, it's
Mm,
going to make you go in much more with an open mind, without having assumptions, without, if it's something you grew up with always wanting to be, you might therefore
yes,
be taking things for granted. So you going in with your eyes wide open,
yes,
so therefore, I guess arguably knew much more what you were getting yourself into.
yes, yeah.
And then so when it came to your choosing your training scheme, then you say you'd already kind of made your own
Yes,
um a portfolio, but what about the
yeah.
actual the GP training practice itself then? How did that come around?
So it was back in the days where it was a lot easier to do your own scheme, and I think it is a shame, and I say that because I am now a TPD, so I'm very familiar with the current pathway of training and why it is, you know, you know, set up as it is, because it is helpful to have that very clear structure. But it was nice to be able to have a little bit of flexibility and also to essentially just extend your GP training. So I did lots of jobs that I did, for example, I did a medical rotation for effectively kind of 18 months or so, which was, really useful to have as a GP. But I ended up applying for a stand. So I made a decision. I left I was kind of in a medical discipline. I decided that I wanted to be in general practice. So I started looking for jobs, and I happened to come across, and I was based in London. I came across a 6-month standalone psychiatry SHO post in West London, and it was probably one of the best GP jobs I did. It was specifically for GP trainees with a
Oh,
psychiatrist who I think, yeah, was very progressive, I think, for that time. He was really keen to have people interested in primary care, and he would send the GP trainees off to spend, a day with a GP who specialised in homelessness. We'd go out on visits to see patients in hostels, and it was, being it was right near Victoria Station, so it was really like kind of raw inner city psychiatry, which was, yeah, I actually really enjoyed it. And because I was in that part of town, I can't remember quite how I did it now. I think you just applied for the London deanery, and you could express where you wanted to do your GP registrar year in. And because this particular job, you were allowed to do the VTS at the Chelsea and Westminster training scheme, I applied for that, and I was lucky enough to get on to that scheme.
wow. And
Yeah.
where was your actual GP practice that you did your training?
So it was in Holland Park in West London. Yeah.
So proper London practices
Yes.
must have been very exciting, interesting.
It was, yeah. I really have some very fond memories of it, and I feel because I had such a good experience as a GP trainee. I had a wonderful trainer who I'm still in touch with today, some lovely colleagues, and I think having that uh, very sound base, I think has helped me to keep my enthusiasm going over, because I finished my GP training back in 2004. So shockingly, yeah, like over 2 decades. And I don't know any GP who, hasn't found it challenging in recent years. But every time I think back to my training and those core skills that I learnt, um, I feel very positive about my career decision. And also my trainer, instilled so many kind of helpful lessons, and you know really sort of guided his trainees, which I think has enabled me to stay resilient over the years.
And not only that, but now you're a training program director yourself, a
Yes,
TPD. You must be reflecting back on your days as a trainee yourself, then bringing that into
yes,
what you're doing.
yeah, definitely. I mean, it has changed a lot. Um, and yeah, but I understand, I appreciate, because training is such a short period
Mm,
of time. It goes so quickly, and I think it's important as far as is possible to try and give those trainees, as positive experience as we as
yeah.
is realistically possible. Yeah, and just to listen to them, and be interested in them as a person. I think that's what was so great as my trainer. He was interested in the whole person. We used to have chats about the latest films, or what was things that were going on, because I think he had small children at the time. So he was really interested in what all that young trainees in his practice were up to. And yeah, and I think that just those little conversations made such a difference.
And then, so when you graduated then as a GP, and then what GP roles did you find yourself moving towards first? Did you sort of qualify and go straight for partnership, or were there other steps you took?
So I think when I qualified, very much the options were to be a salary GP or a partner, but there weren't that many partnerships available. And what made my first career steps somewhat more complicated was that I was married to a surgical trainee, um, and with so many hospital rotations, the geography is quite broad. And I think I worked out when I find so I'm now based, as you know, in Southend, and I remember when we finally moved into our um, family home in Southend, my eldest child was 6, and I'd worked out in her lifetime we'd moved house 6 times. Or
No.
yeah, well, she had lived in I think we moved 5 times. She had lived some in a different place. Yeah, like
Mm,
6 different
mm.
places. So it made it quite hard to put roots down, but I had nearly, so when I first was, so I left London, so I left my, my base,
Yeah.
of, when, I think I commuted into London. We moved to Kent, so I commuted into London just to finish off the last few months of my GP registrar year. Then I was lucky enough to get a job, um, in Kent, and at that time, which was the early 2000s, there was a scheme called the Flexible Career Scheme,
Oh,
and
yeah, I remember
again,
that.
yeah, I know, and I think I was very, very lucky to be on that because that gave me, um, some security and obviously, like, the flexibility, so that was great, and I'm really glad I had that chance to develop my sea legs in general practice, and it was, a really nice general practice. um I felt quite supported. The workload is, I mean, obviously it wasn't straightforward and there's always challenges, but it was manageable. And I do recall pretty much being able to get through my 30 patients and admin quite easily, 9 till 5, and have a lunch break. And I was always, I don't recall ever being, worried about being late to pick up the kids from the childminder.
I was gonna say, you're talking about this, and you've got in the background, you've got what was it, 3 kids by this stage?
So it was 2. So when I moved,
2.
I had 2, yeah, so I'd done that scheme, and then I had to uproot again, and I was sort of getting, I think the thing about general practice in terms of, career development is getting plugged into networks. So I left London, found myself in a new area, getting to know people, and I had some like things in the pipeline that I was going to do. I did. I also managed to do, alongside that job, I was doing, a session a week in the local hospital, doing some work on chronic pain and rheumatology. And that was really interesting, and I'd kind of wanted to develop that, but then, um, unfortunately, with, any, I think, hospital training, you have to move according to where the jobs are.
Yeah.
And I remember, yeah, my husband came home one day and said, "Oh, there's a job going in Southend," and I was like, "Oh, can't we stay here?" And he said, "Well, we either move to either apply for the job in Southend or there's one in Scotland."
Oh, good
Um,
grief.
and because I'm so south, my family were all in the southeast, so I said, "Okay, let's go." But actually, uh, I can say that 20 years on nearly, Southend isn't such a bad place after all, and it had, you know, lots of, great things for the kids, and I've met some lovely people here. But then I had to start all over again, um, because I arrived, there was sort of one GP friend that I had who was very helpful in giving me advice, but I didn't know she didn't live in Southend. She, um, worked in a different part of Essex. But yeah, I really had to start all over again and find my way.
I'm feeling quite stressed just listening to this because that is so many life changes with big commitments,
Yeah.
and you not necessarily being an entirely free agent in this, having to move because of the way the NHS career system works with
Yes.
with your husband and everything. But you seem to have thrived on it. You seem to have almost fed off the energy of those new experiences, and your approach seems to be very much, I guess, a can-do, an open mind. You moved to Kent, and you were also started working in a hospital doing a pain clinic. I mean, you've obviously, do you look for these opportunities? Do they just arise? Is it you just attracted to them? Do you like being busy like that? You must really enjoy all of this.
I suppose I wasn't sort of I didn't have a plan that I was conscious of as such. I think I was very, as I said, I was in as an enthusiastic trainee, and I came out and I was like, "Yay, I'm a GP now and I just wanna get going." Um, and I think what I'd say is I was curious, and open-minded.
Okay.
Um, and I, and I think it's all about when I look back, it's all about so many of the people that I've met. Um, because as we know, there are lots of jobs and opportunities that
Mm.
aren't necessarily, advertised. Whatever the hospital job, that was just something I spotted in the BMJ in those days, where you used to find jobs, on the back
Yeah,
pages,
yeah.
so that you were quite limited in where you looked for jobs. I think at the moment now, there are jobs advertised on so many different sites, but back then there wasn't that many places to look. So I just spotted it, and I think because I'd done a bit of a medical background, I had entered general practice thinking, oh, I would. We didn't call it a portfolio then, but I had that idea of being a GP. I always knew that I wanted to do something in training, so I kept in touch with a friend that I trained with, and we did like some work together on hot topics courses for the then MRCGP. So I was keep so because I couldn't be a trainer, I suppose I thought, okay, I can't settle into a training practice because I'm not staying anywhere long enough. But I kept my interest in medical education going through things like that, and I just did a little bit of writing. So I suppose knowing like what I was interested in, and then trying to apply it when I was in a situation where I didn't necessarily have that traditional route open to me. Kind of, I guess that encouraged me to just look at different ways to do things.
And so then when you moved to Southend, in a brand new alien environment, as it were, how
Mhm.
did you then get back on your feet again, or did you just hit the ground running?
So I arrived in Southend. So I'm trying to remember. I think my son was around 2, and because I'd been on maternity leave relatively recently, because lots of my friends, oh, just to have a little bit of a break, get settled. But I was like, but I've had my break. I want to like get on the next step. And um, I remember discussing it with my appraiser. I had an appraisal just before I moved, and actually my appraiser gave me lots of like sensible advice, and she'd spoken about doing out of hours as a useful way to kind of learn about practices, because you're seeing patients from all kind of
Right.
like different areas. So before we moved, yeah, I got in contact with the out of hours service. um, so I signed up. I think yeah, literally the first weekend that we moved down, I think I was doing a shift, and I also, again, when things were less on the internet, I just thought I had. So this takes us to how Richard, you and I connected through non-principal, which evolved into sessional GP groups. But when I was in Kent, um, I was lucky enough to cross paths with a lovely GP again, who I'm still in contact with today, who told me about a non-principal group. And I found that very supportive as a new GP, particularly
Oh,
meeting other GPs like me. So it was mainly women who were working part-time as locum, salaried, or partners. Oh no, locums or salaried. Some of them became partners. Um, and I thought, oh, I know, I'll join one in Southend. Um, and I kind of like went on Google trying to find one. And then I did stumble on something called a young GP group, which I suppose, in our look back, was a kind of an embryonic version of the first five. But I'm so old, first five didn't exist back then. So yes, I got into that. So I managed to find that, and I just randomly emailed the GP who was running it, said, "Oh, hello, I'm coming to Southend. Can I come and come along to your group?" And yeah, he was very welcoming. So I think those two things helped.
so that's nice. It's giving a nice sort of air cushion, a nice sort of soft landing pad as well. But
Yeah,
starting off in out of hours, that is really going in at the deep end. If you ask me, from my experience of doing out of
yeah,
hours, I
yeah,
always I found it quite terrifying in terms of the risk management involved with not knowing the patients, not knowing the area, and not
yes,
really having them notes as well. All of that.
yes,
Can be a
yeah.
bit terrifying. And then, so over your time then in Essex, then what sort of general practice roles have you been part of, but also other outside of clinical roles have you been?
So, I have been probably over the years, I have worked mainly as a as a salaried GP, but I have worked in quite a few different practices for lots of different reasons. I've changed practices. I think I worked out, um, I don't know, I've forgotten the numbers now, but, I think either as a locum or salaried GP, over the years, I think I've worked in at least a dozen, if not more, practices. And of that, I've been in salaried roles, I think 5 times. So
Wow.
I did do one stint for 7 years in one practice. And I suppose that's given me good insight
Mm.
into how different practices are. And I would say every single practice I worked in had something that was very positive and did work well, and some practices things that I think could have perhaps been different. And I always think, gosh, with all that knowledge, I'd just love to piece it all together and have a practice that brings all those um, very good things together. And I do find that interesting again, like, so speaking to trainees who are looking for jobs, there's this view that, oh yeah, there's this kind of standard GP role, but it is interesting that, you know, it is so different.
Mm. I always like to think of GPs and what we do. We are all of us in a leadership role. When we're sitting in that consultation room with a patient, we're in a leadership role there. It sort of fulfills all the definitions. I wonder, and it's lovely what you say. You pick up on this best practice, and I can't imagine that you haven't, once you've moved to other practices, you haven't brought some of that best practice with you and share that. But in a way, that's part of, I think, what newly qualified GPs and GPs can do. As we move these days more often from practice to practice, it does give more of an opportunity for sharing best practice, but and also not sticking with the same old bad practice that you can
Mhm.
potentially become accustomed to. It's more
Mm,
fertile, I guess, that cross
mm.
fertilization going on. Um, and so now, at the moment, then, what sort of clinical role are you a salary GP again now?
So I've recently moved back to locuming. But what you were saying, Richard, you asked me before about the non, uh, the other
Yes, I
roles
did. I
besides
did.
being, yeah, and and just yeah, just going back to that. So because I ended up doing that early on. So I always when people ask about, how do you become a portfolio GP, or what did you do to, you know, end up doing what you do now? And I what I always say is actually I was a portfolio GP more by accident than design. And I wanted, so after I did that initial, so I worked for out of hours, and then I did manage through, again, it was through networking. I got a part-time salary job, but I because of my interest in training, it was very much, mostly it was trainers who were partners. So I had this, that was my mission, to be a partner in a training practice. But the problem was, back in those days, it was quite hard to be a part-time partner, and also partnerships were quite scarce. And so I remember I saw one partnership offered, and I went along to, there was an invitation to speak to the practice manager and look around. And I remember, her showing me around, and then I just said at the end, "Oh, would you consider part-time candidates?" And she just looked at me very sternly and said, "This job is for a full-time GP." Um, and I remember I, bust a gut to get there. I had 2 preschool children. I paid for a babysitter, put on my suit, gone along to the practice. And I came away really quite, despondent.
Hmm.
And I just thought, "Oh, so, like, I can't have a career because I've had children. It's black and white. I can't, all I can be is, scramble around for a part-time salary post, or, staying out of hours. There's no, there's no other way." And then I then saw there was another job for a partnership, which I applied to, and it was very different. The partners there, who were lovely, turned around and said, "Look, we do want someone who's part-time, but we think you'd be quite good for our practice, so we're going to take you like supernumerary, as an investment for the future. And I was, so kind of bowled over by that kind of, more progressive
Yeah,
outlook.
yeah.
But it was at that practice. So shortly after the first encounter I mentioned, it was at that practice that I just, again, it was in the days where everything was on paper, and they were just shared an LMC letter about upcoming elections, and they were looking for someone to be a sessional GP rep. And I think from that experience of just feeling very dismissed,
Mm.
I think I channeled that. I obviously I didn't think this at the time, but now I look
No,
back and I
no.
see, because I did feel quite angry, and well, just frustrated, I would say. It was kind of the overarching
Mm.
emotion. And by that time, through meeting the GPs that I'd met in the out of hours, I'd started to form my own little sessional group. And so with their experience as well, I decided, you know what, I'll just put my name down, just have a go. And I think that, and then I got onto the committee as one of the sessional GP reps. And I think it was just doing that, and that was partly like serendipity, but I think it was also driven because I was keeping my antennae up for, like, other opportunities and things. And so it was that step that then led me to just become aware of other opportunities. And again, I had no idea at that time, but I also see that as the very first step in developing my portfolio, essentially in GP workforce development, which is where I am today.
And I guess through that LMC role, similarly, you've had exposure to other opportunities as well.
Yes, yes.
And has and working within the LMC, and outreaching to local practices and local GPs, has that been another way for you to sort of, I guess, spread best practice? And I don't necessarily mean clinical. I mean, we were talking about that situation where you're almost dismissed unless you
Mm.
could be a full-time GP. Have you managed to, I suppose, slightly sell that sort of part-time, flexible, have a a nice different balanced portfolio of work? Is that something that you've been able to work on as well?
Yeah, I think so. I mean, I think certainly that approach is a lot more visible today. Um, and it was uh, something that wasn't as easy to create all those years ago. But I think I think what it allowed was just kind of meeting other people who were influential, and meeting other GPs who were similarly enthusiastic. So shortly after joining the LMC, one of the other reps, who I think she ended up doing a brief stint as a sessional rep from the GPC as well. We just took it to a few colleagues, um, to try and run a sessional GP conference. So back in uh, 2011, it was, we got the first Essex sessional GP conference off the ground, and that was uh, that was a really exciting opportunity just to connect with other sessional GPs. And that had an educational content. So again, it was allowing me to pursue my interest in medical education. And I went on for a few years to do specifically sessional GP updates. And I suppose again, I can see that thread continuing today, because I was very keen to support again those GPs who may not be doing those kind of conventional full-time roles, although I suppose that they're not uh, as kind of the mainstream general practice as they were 10 years ago or so. So one of the things that I've been doing for the last uh, 2 or 3 years is doing periodic half-day webinars for GPs who've had career breaks, so whether it's maternity leave, parental leave, sabbatical, sick leave. And we have a lot of sessional GPs who come to that. So hopefully I've raised the profile of just the diversity of GPs in my area, and that they should be valued by the system. I think that's what I feel very strongly. That it doesn't matter what your contractual status is. Even if you're working, I'm going to put just in inverted commas, one session a week. I think that the patient seeing you should expect you to have the same opportunity to stay up to date. And it's not like, right, I'm just going to do half a consultation because I'm
Yeah.
part-time. You're still
Yeah.
doing like a whole job with the patient. So I guess I've been quite fervent about um, ensuring that sessional part-time doctors get access to high quality um, updates and information about what's going on in their system that they're working in.
But I think you've done much more than that. I mean, and I know these conferences you've talked about because you've often invited me as a guest or as a speaker or there as an ESGP with our stand, and I know Sarah's been along to some of those as well, um, and we've talked to so many people, and those events are they're huge. I mean, there's what 100 odd people at those events, and they're all day events, and I remember them being at weekends, and you having big crowds there, and and like you say, been going on for some sort of 10, 15 years, and very few other parts of the country have had that sort of similar thing. If for going as long back, and but also it kind of all seemed to start off with a certain Kamilla Porter moving from Kent to Essex, and immediately getting that network going, and then your journey through to the LMC, and I imagine what you've created there has probably helped dozens, if not again hundreds of GPs who over the years have just knowing that there is a network there, and you're not on your own, we're all in this together. Your interest, you're bent towards education and training. I think, as a leadership, although we don't think of you as Dr. Kamilla Porter OBE. We should do, but you've done so much in leadership, I think, and I think you should be recognised for that.
Oh, that's very kind.
Well, yeah, but it's as an organisation, we are obviously, we're trying to support from a sort of a national level, and in order to do that, we often need key individuals around the country, and we've been going, as you know, thanks to you and others in Essex for a good 5, 6 years.
Hmm.
And still, despite financial underfunding, your ICB is still funding the platform, membership and locum debt for all the practice and locums, because it's got this rich legacy
Hmm.
of openness and support. And I just wish maybe there are more Camillas around, and I think I think general practice would be in a lot better place for it. So yes, so I think that's why it's so great having you on this podcast, Camilla, as well. I think because to get your story in front of more people, it's just I think just so inspiring, and it's so inspiring too. So great to hear that you are now a TPD. And I know you and I have had conversations for years about you wanting to do GP training, and it
Hmm.
now seems that you've found that situation now where you're a GP locum and you're a TPD as well. How did that come about then? Did something change, or did you just in the end they just gave up and gave you a job?
Um, no, I mean, it's not quite like that. You have to wait for the opportunities. I think, um, I mean, that's one of the advantage. So one of the advantages to locuming is it can give you some flexibility
Mm,
in like what jobs you apply for, because I'd seen TPD roles advertised before, but I was, so caught up in a salaried role. I knew I didn't have, um, I wouldn't be able to commit to you know uh, a role like that, and I left a 6 session salaried post at the end of December, and over the last year or so, I've been very lucky. So maybe going back to what we're discussing earlier, and again, what I try and encourage in, like, new GPs that I meet, is to stay vigilant, stay connected, just look out for opportunities, and just have a go. Um, and I know I was initially going to have a little bit. I took a bit of time out of clinical practice, um, but I had been lucky enough to be part. A couple of years ago, I applied for a leadership development program. It's called the Circles program,
Hmm.
which is for uh, developing women leaders, run by the King's Fund. And I was extremely lucky to get funding to be part of that. And one of the things that that program, I think, really helped was just um, to get you to think a bit about yourself, because I think it's quite easy to get trapped into thinking that being a good health professional, being a good GP, it's all about outcomes, outcomes. What do you deliver? And sometimes we don't have that time, especially in the high pressure environments we work in, just to think about, what are your drivers? What gives you meaning? What, why are you doing what you're doing? Because you can just be so submerged by work. And I think I realize, again, I'm not saying that, this is like I consciously like set up this career. It's funny how things just kind of evolve. Um, and for me, the culture that I work in is really important. And that was one of the reasons why I sort of left my last post. And I thought, right, what is it that I really want? And as we've been discussing, my heart is in education and training. Just because it started out from just wanting just to stay up to, I just wanted to stay up to date, and I enjoyed going to courses. It's kind of as simple as that. Um, but I also appreciated the the positive relations that I'd had over my career, those very kind of caring conversations, um and that for me, thinking of, with the kind of years of general practice I had under my belt, I thought, right, I don't need to do something else to prove myself to someone else. This is about kind of doing what I want to do, what feels true to my values. Um, and I saw the TPD, and I thought, well, I'm going to have a bit of time out to do like even a bit more reflection. The TPD job came out, and I thought, do you know what? It's in my local area. I know some of the other TPDs who'd be lovely to work with, and I should say it is just one session a week, because our training scheme has expanded to so many trainees. So we have three who do a full day. But because we're expanding, we needed some extra TPD time. So I thought, well, this would be a great opportunity to harness my experience. So I applied. Thought I may not get it, but yeah, I just applied. It came out this year, so I was very lucky. So it wasn't necessarily something that I had thought when I left my last job. Right, I'm going to do this, this, and this. It was just kind of what opportunities came up. And I did a few other bits and pieces. So yeah, so I really have taken on what it means to be a portfolio GP to heart, because I'm doing lots of different things, but they're all things that are connected by even though some of them might not sound directly to do with being a medical professional, but they all align with my professional values and my interest in growth and um, medical education.
Yeah, I was just thinking there's a formula here, isn't it, to make a Kamilla Porter, and what it is, it's having these strong values. It's, I suppose, the luck of having such wonderful, inspiring early teachers in your career. And there's tenacity here, isn't it? You apply for job, you stick to that. You'd be stuck to this for 20, 30 years of repeating this. And you're open-minded, but also you've said twice now, I applied for it and I didn't mind if I didn't get it. You're not the fear of failure isn't causing you to get set back.
I think I can say that now, as a new as the new GP, getting knocked back was hard.
Yeah.
Um, But I think one of the things that I realise, again, it's why it's just so important to have those moments just to stop and reflect and, rather than kind of jumping into reacting, and, 'cause it is hard, and I've got better at it, but when I have stopped to think about things, I realise that, when a door slams, and I had lots of doors slam in my face, and I don't know who's had a career without that.
You.
And I look back and I think, but I just kept trying to find, even if it's just a chink of light through another door, I've got bolder about knocking on that door. Um, and I think one of the nice things about, being of a certain age, getting older, is I think, I mean, obviously, clearly, our reputation should manage to all of us as professionals, but I
Mm.
think I'm less worried about what others think about me, and what's more important is what I think about me, and knowing that I'm doing something for what I think are the right reasons, and following my own compass. And I don't mean that to sound as being, arrogant, but I feel it's actually quite empowering to feel bolder about
Mm.
yourself, but at the same time having checks on yourself that you're not, veering off in the wrong direction, and also always just keeping open-minded to like constructive feedback. And I think that's what I found so helpful, in the different things that I've done. So we talked about the sessional GP conference, and I should point out, unfortunately, that for lots of different reasons, just with all the kind of changes in NHS infrastructure and things. I kind of moved away from that because I went on for other things. But the last sessional conference was in 2016. But I'm still in the other updates and things I do. I
Yes.
very much try and include sessional GPs in that. So when I was doing those sessional conference, I remember thinking, oh, I think as a sessional GP, these topics would be really good to cover. And colleague saying, oh, actually, I'd really like it to get, like, can we get BLS training? And I remember thinking, oh, but that's a little bit boring to have in a conference. I know I was kind of, it's really interesting to have the kind of medical politics and also, some of the hot clinical topics. But actually, the BLS proved to be such a popular thing, particularly for locums, because they were finding it so hard. And I think that taught me why it's just so important to listen to others and not to assume that you necessarily have the answers, even though you may be very experienced. And um, I think that ability, just to always be able just to question yourself, as well as
Mm.
being confident, getting that balance right. That's what I was trying to say is important, and not to, because you're experienced, just think you know all the answers, because we don't. We all have different experiences, and it's so important to consider, um, and other people's experiences and perspectives in the system that we're all working in.
Yeah, definitely. And so what next then, sort of for the future? You said you're of a certain age, but you got plenty of time to go. So what do you think your plans are next, or do you just not know?
Um, I hope I can stay in the arena of workforce development and training. I still feel committed to general practice, um, and primary care. Um, I I also think that it is important as we get older to also, I mean, it should be important really from day one, but to have time to look after ourselves and invest in our own well-being. So one of the things that I've done this year is I enrolled in a 200-hour yoga teacher training course.
Wow,
Yeah, I graduated 3 weeks ago. Woo.
congratulations.
Thank you. And I think I we were saying at the start before the podcast, I'd had my, 30-year reunion,
Mm.
and just talking to some of, my peers, it's just that actually, we have worked hard for a long time. We've given decades of ourselves to the NHS, and it's not selfish to say, actually, I also want some time for myself. I want to do things that really interest me, but still in some way contribute to our profession. But that doesn't mean, so being a good doctor doesn't mean, absolutely caning yourself
Mm.
12 hours a day, until you're 67, 65, or whatever. Um, and actually being able to contribute to future GPs, to newly qualified GPs, um, and to like keep, to have that longevity in your career is really important. And I think, and I do feel sad, I do come across quite say, I'm going to get to the stage, I'm out, that's it, I'm done. And I think I don't feel that way, because I have been fortunate enough to find a path where I can combine different things. So I feel at this stage, I know I'm not going to go back to doing 6 or 8 sessions, not because I don't like general practice. I really do, but I feel that, I'm lucky enough to have an opportunity. So, we talked at the beginning about how you can start your career thinking, I want to do this, I want to do that. And I feel maybe I've got a stage where actually I can't necessarily do all those things. I still get excited looking at new roles and things like that. And I thought, actually, but I want to support other GPs to do that,
Mm.
to try and help them have meaningful careers, to do things to, up their level of practice if they want to have an opportunity to develop a a portfolio interest, and help improve patient care in the system. Um, that's something that for me would be a huge sort of privilege to
Yeah.
continue in that. So in terms of future, I do want to stay in practice. I'm currently doing on average maybe two sessions a week. It can sort of vary as a locum, but yeah, hopefully still the problem with the NHS, and again, this is about, and I understand why it can be difficult to balance all the risks,
Mm.
when you're worried about paying your mortgage and all of that, but with a lot of clinical lead work for the NHS, you're faced with contracts that get renewed every year without long-term certainty.
Mm.
Um,
Exhausting.
so it's quite, but I've managed to stick it out for 4 years in my GP GP workforce clinical lead role. And I want to stay in that sphere, but whether the post that I have will be exactly the same next year at this time, I don't know. But I'm actually okay with it, because I've been in that in that situation for so long.
Yeah.
And just just make the most of it when I've got it. And that's what I say to trainees, well, when opportunities come, don't think, oh yeah, maybe I'll do that next year or this year. If it's something you want to do, have a go at it, because there aren't often guarantees that the exact same thing's going to be there in the future. So um yeah, I will keep going. I don't have a fixed plan, but I'm really enjoying where I am at the moment.
And I'm sure there will be other opportunities that come up that don't even exist yet, which we might just
Exactly.
have another go at or something.
Yes. Yes.
You've mentioned you've mentioned yoga. So that's incredible. The title for your autobiography should be Kamilla Porter, the Flexible GP, I think.
Yeah,
Yeah,
maybe.
yeah. So but when you're not being Dr. Kamilla Porter, and even when you're not doing yoga, what else do you do to relax, to unwind, to recharge your batteries?
So one of my passions is reading.
Mm.
Um, and it's really hard to do sometimes. And I've missed the last couple of months 'cause I've been so busy. But I've found a lovely book club. It's part of an independent bookstore. So I'm in a book club. And we know actually when you look at um the there is good evidence to say that actually reading is good for our stress levels and our health and well-being. Um, and it's a great way to escape from
Mm.
all the other things going on. So I try. It's not always easy, but I try really hard to keep up with that. So I enjoy reading. My kids are really into drama. My daughter is crazy about musical theatre. So like going out. One of the nice things about Southend, I really think it's the two big jewels in the crown of Southend is they've got two fabulous theatres. Um, so yeah, I try and we get some kind of like West End production. So yeah, then that's a great way to just switch off. And of course, I've got the seafront. So
Mm.
yeah, if it's not too hot and not too cold,
Yeah,
but
yeah, yeah,
even the cold weather, you can just layer up. But yeah, just um, going for a walk after a long day at work can be quite restorative.
yeah. Lovely. Well, Camilla, it's been so lovely having you on the podcast. Really good chatting to you again and going through your career. Uh, thanks again, and I know we'll be keeping in touch and maybe have you on again in a few years' time and see how the yoga career is going as well and what other opportunities have come up. Thank you.
Oh, thank you so much. Really chuffed to be here and lovely to see you again, Richard.